Good morning, Singapore, and good morning, world. Welcome to The Big Show and The Big Show TV. The Big Show TV, of course, is our Facebook page, 1FM 91.3. And a reminder once again, on the 16th of December at 8 p.m., log into The Big Show TV, which is our 1FM 91.3 Facebook page, and join us for one naughty Christmas.
Awesome stuff. That's going to be so good.
All right. Our guest for this morning is also, I'm sure, quite naughty.
Very naughty.
Dr. Geraldine Tan from the therapy room.
I was just sitting here quietly and I kena sabot. Oh, yeah.
That's what we're about, Jerry. That's what we're about.
How are you, Jerry?
I just woke up.
Oh, wow.
Lucky you.
No, I just woke up from your comment that I'm naughty.
Okay, so, this morning we're talking about selective mutism.
Yes.
What is that? Sounds like the silent treatment to me.
Yeah.
No, it's not the silent treatment, but many people confuse that, and it is actually a legit disorder. So again, I'm going to bring this big book here, and this is the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition. I think they're going to come out with a renewed one next year, so we all got to relearn it again. And it is under anxiety disorders.
You get... So what is this? You get so anxious that you don't want to speak, or you get so anxious that you can't speak?
The anxiety takes away the ability to speak in certain situations. That's why it's called selective mutism.
Wow.
Yep.
That...
It's fascinating.
I can't even imagine what that would be like. I'm put in a situation where I'm so anxious I can't verbalize what I feel.
Is it like a deer in the headlights kind of moment where you are struck with this sense of fear or anxiousness for this case, and you can't move?
So that's for it to become a disorder. It has to be persistent. It has to be pervasive, and it has to last for at least a month.
Oh, wow.
Yeah. So it's not like, I'm struck speechless, or I'm so angry with you, I cannot speak at all, or I feel a little bit shy and I can't speak to you. But it's just at one time. No, it's not. It's more
How do we know, Jerry, if someone is just, putting on an act?
Yeah.
Because the person can say that, he or she is, or rather not he or no, because the person is not saying anything, right?
Yeah.
So it could just be maybe the person doesn't want to talk to certain individuals, right?
Yeah.
And just decides not to speak
And be selectively mute.
You see, the problem that I have over here, I'm thinking about this, is that everything is a mental disorder these days. Well, you know what I mean? Sometimes I just feel like when there's something wrong,
it's a mental disorder.
It's a mental disorder. Do you get that a lot, Jerry? Do people actually question you about that, and do they say, where do we draw the line? Every single thing is a mental disorder these days, right? But when we were growing up, we experienced some of these things, and no one said that it was that we had a mental disorder.
Yeah.
But now, everyone can justify their actions by saying,
it's a mental disorder.
Or it could be a mental disorder.
Yep. Interesting that you say that point, because I'm going to talk about depression later on in the afternoon in the National Counseling and Psychotherapy Conference, where they where I'm supposed to present whether it is a social phenomenon or not. yes, a lot of people feel that, we try and excuse our behaviors with disorders, but disorders are disorders. It needs to cause a dysfunction or impediment somewhere in their functioning. Got a red
Okay.
card, so which means that I will continue later.
That's right. We'll continue on the Big Show TV. In the meantime, here's Colby Kylie. Haven't heard this one in a while. This is Bubbly on 1FM 91.3. Good morning.
So, for any of this to be a condition, it has to affect my life. This is what we're
For
saying.
a month.
Minimum.
Minimum.
Of a month. Wow.
Yep. So it causes a disruption in the school if you're studying or in the workplace. So easier to use the students because many of them will come forward brought by their parents, right? So children would come and they can't speak at all in class.
Okay. Total silence, or are they going like
Total silence.
Total silence. Okay.
Total silence.
Like a shyness.
Yeah, so an extreme form of shyness, right? But when they are with the family, they can talk, they can converse. Yeah. But in the school environment, they might not be able to speak at all. Maybe they can't speak to all the teachers, they can't speak to the bookshop auntie or the store holders. But they may be able to say a word or two with their friends. That's why sometimes they get scolded for not speaking up. They get misunderstood.
Yeah, but I mean, with Asian culture, you're not supposed to speak that much anyway, right? I mean, when I was growing up, I was asked to shut up most of the time. It's like, Glenn, shut up. Only speak when you're spoken to.
Yeah. Kids are supposed to be seen, not heard.
Yeah. Which is why these days I'm so reserved, you see.
That's reverse psychology.
Right, sorry about that. So other than this not being able, because we are talking mutism, other than this not being able to speak, are there any other signs or symptoms that would lead us to think that perhaps my child or someone I know has this condition?
They have okay. It's really, really hard to figure them out because they just stay silent, and it's easy to miss them because if, like you say, students are supposed to be quiet, if they're not disruptive, it's okay. But it's when they start to not be able to answer questions in class, or they're called upon to read a passage and they can't do that. Or they can't even do their oral examinations. That becomes a problem. So only when we see that, or teachers see that they are alerted to perhaps there is an issue. There might not be any other issues, but it can come with other issues like stuttering. It can come with anxieties in other areas also.
Then
Or social issues.
is it just pressure of school? If we're talking about students, is it just the pressure of school?
Where they just don't feel like, talking, like the Rod Stewart song. I don't wanna talk about it.
No, it's not that they don't want to talk, but they can't talk. So by the time they come here, you can see how difficult it is. One of many years ago, there was one of these girls or teens that came, and literally we had to shape our mouth to try and get her to project even a sound.
Wow.
Yeah.
Wow.
So
You're like speechless.
I'm trying to
Selective
figure.
mutism.
I'm trying to figure. It is sounding like it is. It boils down to fear. Does it boil
It
down
is.
to fear?
It is. So it is an extreme form of anxiety disorder. It comes under the umbrella of anxiety disorders, and it manifests itself in the inability to speak in certain situations.
Okay, let me give you an example. So I'm just
Yeah.
thinking about
Yep.
this, right?
Okay.
So one of the most stressful
Yep,
things
yep.
is public speaking. So let's say someone who's not experienced, in public speaking, right, is asked to speak to a crowd of 1,000 people, and is pushed onto the stage to face 1,000 people,
And they freeze.
and they freeze.
They choke.
That's not mental disorder,
No, it's
Yeah.
not.
but it's
not.
also brought
It's
about by
okay.
anxiety that they are absolutely speechless
Yeah.
and can't
Yep.
go ahead with addressing the 1,000 people. So
But
how do you make that distinction there?
So
It's a
the
one-off
public-
thing, is that it?
Yeah, so it's a public speaking. You're not really required to speak, or present. I mean, if your work requires it, you can change your scope of work. We're looking at these people who cannot function in a certain environment.
Like day-to-day life, like it disrupts their day-to-day life because of this disorder that they have. So could it even like happen when the person is trying to like order food or something like that, and
Can.
you can't speak or you can't, you just freeze there. So it disrupts your life that way.
So you have like the little kids, right, going to school. They can't speak to the store holders. So what they do is they don't order at all. So, the recess money just accumulates. And one day the parent goes, "Oh, you mean you haven't been eating in school?" But they just can't bring themselves to go and speak with anyone at all.
What causes that? I mean, you're merely ordering a drink.
Yeah. Once again, anxiety, as Jerry mentioned, could be one of the
Correct.
causes. But the
Correct.
problem that I have with this, Jerry, is that it is called selective mutism. I think we've
Yes.
all been selective as to who we want to speak to or when we want
Yeah.
to talk and stuff like that. So if you were to say mutism, I understand because I mean you stay mute. Because you're under some form of anxiety, right? And it's consistent, as in like for a whole month,
Yeah.
you don't talk to anybody.
Yeah.
You're just quiet, right? But when you say selective mutism, I can choose which situation, I
Affected
I mean, I can choose which environment I want to stay mute in. You know what I mean?
I think you've got that wrong. It's not you that's choosing. It's the
Exactly.
situation. There are situations you're in where you just can't speak. That's why it's selective. It doesn't happen all the time, but it happens in specific
Yeah,
situations.
but isn't that normal? I mean, to me, that's normal. You've been in a situation before. Maybe not. You can talk your way out of anything. But I'm saying there are some people, right? In certain situations, they choose just not to talk. Like, for example, if we were at a meeting and we wanted the meeting to end early, okay? So I don't want to say anything because if I open my mouth and say something, the meeting is going to drag on for longer.
So you are selective.
So I'm just going to be selective about this situation and shut the hell up.
Oh, I so regret doing this topic today.
No,
For
but I
the
think
listeners
that
out there, can you please not use this excuse?
but Jerry, that is a voluntary selective choice. What you're saying
Yes.
is it's completely involuntary.
Exactly. It is not a choice. It's
Yeah,
the
it's
inability.
Okay,
The
wait.
person has no control over that situation.
Okay,
So
FD,
even
you
if-
bring it up again.
Yeah,
Okay,
yeah,
Jerry,
so
we're going to
maybe
go on the radio. FD will bring that up just to
Okay.
define
Fine
this.
this. Yeah.
Yeah.
Here we go.
Depeche Mode with an appropriate track for this morning. enjoy the silence. We're talking about selective muting,
Yeah.
right? Selective muting, and I have to say, I wish I had the ability, right, to mute some people.
Mute some people.
Like a remote control. It's like, you
Yeah.
shut up right now.
The Adam
Press the mute
Sandler movie
button.
click.
Yes, like that Adam Sandler movie. I loved it.
Yeah, it's
It's
a
like,
good
give
show.
me that remote
Remote.
control.
But
Okay.
Jerry, when we talk about selective mutism, we're talking about it's not that I'm at a loss for words or that I choose not to speak. These are situations that occur, and I have no say in it. I just can't talk.
No. So you are unable to articulate,
Yeah.
and it is out of your control.
So
And no
is it
one can force you to speak.
Is it different from what Inez says? Been through that, total mind block, unable to speak whenever I'm extremely anxious.
Right. There you go.
He's calling it a mind block. Is that the same thing?
It's slightly different, So that one, yes, anxious, but you're not selectively mute. You can use methods to help you through. Sometimes the selective mutism, the anxiety is brought on by many different sort of causes besides just the anxiousness. It could be like for some of them, they have a stutter, or they have poor language abilities or language issue. And they've been made fun of, or they find it very difficult to speak. So they then fall silent in certain situations where they think people will not understand them. They have poor self-esteem. Trauma also can cause that, a traumatic experience in the school or in the class or in the workplace. Family history of anxiety disorders. And different family members can manifest their anxiety disorders differently. Perhaps another family member having selective mutism.
So, if you're talking about family members having these disorders, is it then genetic?
So all the disorders have a genetic component. You are predisposed to it. It might not be that you would definitely have it, but you're predisposed to it.
Wow, I didn't know that. Well, that's quite interesting. Frida says, my last child will talk a lot at home, but when she's outside, she seldom speaks. Is that a form of selective mutism? Or is that just shyness?
We must find out why, right?
Yeah. So seldom speak doesn't mean that she doesn't speak at all. So these children, when they are mute, it's really mute, right? So I have one of these teen girls. She came because her mom brought her from a very lovely school, a really sweet child, sweet teen, and she could chatter away with the mom. So she came into my session and she could say hi. She was shy, but in school she couldn't speak at all, to the extent she would shiver when the teacher calls on her, to read out something in class. She couldn't even do her oral examination. So, but she could speak with me. Okay, so it was only in the school environment. She could speak with her friends outside of the classroom, outside, in the field and everything, but not in the classroom. So for her, it was clearly there was a high anxiety in that environment. So we needed to work through her anxiety.
Maybe something happened in the classroom. Or did you ask her?
Perhaps, but I never found out. She could only say it was stress, right? But I never found out if there was a trigger. So what we had to do was to really break the whole communication process for her, and to then bring it into the classroom environment. So for years, she didn't take her oral until she came for therapy, and then what we did was to then find a way, to work around the system. So she did have her oral in the end, but with a teacher in another classroom, just the teacher and herself.
Wow.
Do you think it would have helped if, someone had taught this student sign language?
Okay, I'm going to come back in a while, and Grace is following the same train of thought that
Right.
you have on our
Because
Facebook
it
page.
might be easier
Yeah.
to communicate.
A very interesting question from Grace coming up next.
Okay, meantime, here's Maroon 5 with Memories on The Big Show, 1FM 91.3.
So
Right? Because it might be easier, right? To express.
Yes, Grace is on
oneself.
exactly the same track you're on. Grace says, if a person is still able to speak via writing notes or bodily actions,
Right.
Oh, yeah.
instead of articulating verbally, is that still selective mutism?
If they can communicate via a different method, it is still selective because they select the method that
Right.
they use. But generally, the cases that we see, they even using another medium is very difficult. It's almost like pulling teeth from them.
Right.
So
Wow.
So they can't even communicate via WhatsApp, for example.
Wow.
Yeah, or just texting.
selectively they can, but they might not do it with whoever that is there, you see. So it's not that they refuse to communicate with the person. It's because they cannot communicate.
Right. Right. It's their train of thought.
Yeah.
It's not.
It's blocked.
Yeah.
It's not functioning normally.
It's a disorder.
Yeah, I just want to say selective mutism. I practice that for my WhatsApp group chats. Selective mutism.
I practice it for all messages that come through on my phone.
After 10 a.m., we can shout, we are all muted.
Okay, we're getting so
dear.
much. We're getting so much response, Jerry, from our Facebook page. Mol says,
Wow.
I used to be very quiet in primary school. To me, it was because I was from a broken family and I couldn't find anyone to identify with in school. My teacher's comments in my report book was that I am very independent. My personality changed when I went to university and found many friends who were in a similar background to me. Was it that trauma of the broken home, the lack of self-esteem? These were the factors that led to this being unable to speak.
It is highly possible because one of the causes is poor family relationships that can cause selective mutism also. The fear of, I don't know who to trust, is my environment safe? Because with anxiety, they need to know that their environment is safe. If their environment does not feel safe, they would not want to make themselves vulnerable in any way. So just a happy breakthrough with a little boy. So this little boy, his parents brought him to me because he's very quiet. They say that he's very quiet in school and in his enrichment classes. So his parents say, can you help him to communicate a little bit more, because he is getting angry, throwing temper. So he appears to be also very dysregulated, but he has very, very high anxiety. So the parents are really lovely. They get him to write out, and he would read the passages to me. So these parents are really awesome, and it's very interesting. So in session, there was once he just stared at me and he couldn't speak. But the previous session, he could speak. So I said, is there something that I need to do? Is there somewhere I need to be? So he patted the seat beside him which was where I was seated the last session. I was seated side by side with him. And he patted there, and I was like, oh, so you want Auntie Jerry to sit beside you? And he said, yes. He nodded his head. He didn't say yes. The second I sat down, he could start reading his passage. It was awesome.
Was it the fact that you
felt safe? You made him feel safe.
You were his safety.
No, because it could be that I was making him feel intimidated by just staring. I was seated across him and just looking at him, which that eye contact may make him feel very, very uncomfortable. So that was one. And just last week or week before, he was able to go around my entire team to shake their hands.
Wow.
Now, I had told him, you don't need to speak. He paused for a long time, and then he wrote on the paper, are you lying? And I was like, oh dear. So the fear, the distrust, of his environment is very telling. And I said, no, why don't you try Auntie Jerry? Because I won't lie to you. If I say no talk, means no talk. Just shake hands. Are you ready? And he thought for some time, prepped himself, and then we went round to shake everyone's hands.
That's brilliant.
And I came back and I said, see, I didn't lie. So the anxiety sometimes blocks them and prevents them because they don't feel safe.
Right. Jerry, you said something about this little boy earlier, and I think I don't understand it, and maybe some of our listeners don't. You said he was dysregulated.
Oh, dysregulated as in emotionally dysregulated. So the magnitude of the emotional responses are very huge and may not be appropriate for the situation.
Okay. So one more thing. I mean, selective mutism. I mean, obviously we've been talking about anxiety and all that, but are there any other reasons for the person, to be in this selective mute mode? Maybe other issues. What are some of the other issues that you've come across that causes selective mutism?
Okay, so perhaps case studies are easier to explain this disorder, which is quite elusive. Okay, another teen actually came, and she was able to speak with me. Not that she's not able to speak with me, but she comes across as a very curt teen, even with the people outside. But she would not speak in school. She would switch off her Zoom, her video. She doesn't like to look at herself at all. We needed to actually learn how to, just remove her video from the Zoom meetings.
Dr. Jerry,
so that she don't.
We do this on air again?
Yeah.
Okay.
Yeah,
This
bring the case study up
this
again.
case study.
Okay.
We do one traffic
We'll just
first.
I'll just say more case studies. Okay, cool.
Yeah. Okay, everybody, yeah?
Good morning and welcome back to The Big Show and The Big Show TV. It's a Tuesday morning, and so we have Dr. Geraldine Tan from the therapy room with us. Once again, good morning, Jerry, and we're talking about selective mutism this morning.
We are, and I've got another case study just to help us explain the whole mutism, which is so elusive, right? So one of the teens, she came, she can't speak with me. She comes across as very curt and very curt to everyone also. But she would not go to school. She doesn't like to, so she doesn't speak in school. She hates going to school. She doesn't want to go on Zoom meetings. She hates how she looks. So there's body image issues also. And then we realized that she was trying to cover up a stutter. Yeah, and so she was very conscious and very embarrassed about it. So she chooses not to speak, and she cannot speak in school. So even if she has to speak with us, it comes out as very short burst of words clumped together, which then she sounds abrupt and very, very curt. So for cases like this, there are two parts to it. One, we send her off to a speech therapist who then works on the language component, how to pronounce, how to pace yourself, and also the self-esteem, body image issues.
Jerry, there's another list. Sorry, we get so much on our Facebook page. I have a friend, says one of our listeners, that doesn't talk at all. He speaks only when he needs to answer a question. The reason being, when he speaks, he sounds like a child of 3 or 4, but he is
like David Beckham.
But he is in his late 20s.
Yep.
Could like you said, this girl has this image problem. Could this whole how I sound be another cause for selective mutism?
So it's a very, very fine line here. So one, he needs to have an area that there is a dysfunction. That means it's causing him a dysfunction. He cannot function in a certain area. Second, it is not a choice that he made not to speak with the other person. So for the teen, she cannot speak in that environment. And she cannot go to school. So it's gotten to a point where the anxiety is so high, she can't go to school. So it's become a dysfunction. And it's not her choice not to speak. It's I can't speak. If I think about it, I can't even put that cluster of words together to, share my thoughts or share my opinions in that environment.
Jerry, I want to ask you, how dangerous is selective mutism? Because we seem to go back to anxiety. Tell me if I'm wrong. I see if it's not looked after properly, if it's not treated, that leads to depression.
And the other D word, divorce.
No, I'm looking
If
at.
we're talking about,
No, I'm
if
looking
we're
at
talking
couples,
about like
yeah.
married couples.
Well, I'm looking at kids who may not be mentally or emotionally strong. So you go, anxiety leads to depression, and depression leads to the S word.
Yes.
Wait, hold on. Yes, what?
Yeah.
I'll be honest, suicide.
Oh,
Suicide.
you have to explain these things. But everyone will be thinking, what is this S word?
Is that really a possibility with conditions like this?
I'm actually so glad that you brought it up. So a lot of times parents think that it would go away, and in truth, 1/3 of them get better over time. They learn coping strategies. Others kind of deal with the situation and cope with the situation. But there is another third that deteriorate over time, and worse if they have comorbids. And comorbids means another disorder that comes together with it, right? So you talk about the depression. Can they fall into depression? Can they spiral into depression? Yes, they can. They can have a social withdrawal because they can't have friends. The obsessive compulsive disorder, because that's also under the umbrella of the anxiety disorders. So depression, we talk about it. Developmental delays, so they can't progress. Communication issues, and all many other issues that can come together with this disorder.
Wow.
Okay.
Yeah.
Okay, tell you what. Let's continue to talk about this a little bit more on the Big Show TV, and I wanna talk about married couples.
Okay.
Because I think it could be either way. Either the wife is suffering from anxiety, or the husband is suffering from anxiety, and they don't talk to each other anymore. Whether that's part of selective mutism or not, we'll find out from Dr. Geraldine Tan exclusively on the Big Show TV. In the meantime, here's Michael Bublé featuring Shania Twain. White Christmas, Merry Christmas. I'm dreaming.
Okay, never mind. You're dreaming. What, you married couples are?
Yeah. So married couples, right? And they don't talk to each other quite as much because they're afraid if if they open their mouths, then a fight will ensue. So they end up just keeping quiet. I guess that's not selective mutism, right? Because
it's not selective mutism.
Okay.
That is lack of communication.
Exactly. So they don't communicate in the areas that they're supposed to communicate in, but they communicate in all the other areas that they should not be communicating, like, hurling different names at each other, dredging up like history, having arguments. So I'm sure that they are not mute. They are selectively choosing their words, so that's not selective mutism.
But it could be a cause of anxiety as well if it spills over, right?
Yes.
So let's say if the person is really unhappy at home, really anxious because, let's say, the husband is abusing the wife all the time. Maybe when she goes to the office or, the environment out there, she just wants to keep to herself and not say anything. It's possible,
Interesting point.
Because, that's part of anxiety. It's part of stress.
If you're talking about them keeping their troubles to themselves and not talking about it, I don't think that's classifies as selective mutism. They still would be able to converse with people, do their work, unless it starts to affect their work, or they start to withdraw from their friends. So but it doesn't mean that they don't communicate with their friends, you see. So that's why it might not classify as selective mutism.
We've got another. I haven't seen the Facebook light up like this in ages. Adnan Lal.
Yay!
Yeah, it's really good. Adnan Lal is asking, is apraxia a form of selective mutism?
Apraxia.
Apraxia.
Never heard of that.
I've never heard
Googling
of
it now.
apraxia. Apraxia is a word that I've never come across. And Adnan is asking if apraxia is a form of selective mutism and how can we fix this?
Apraxia sounds like a drug.
Do you want me to
Sounds
read
like
out,
it sounds like a painkiller.
Yeah.
read out the Google
Yes.
definition?
Shaun. Okay.
All the aphasia, apraxia, all these are neurological disorders.
Okay.
Yeah. So, according to Google, it's a neurological disorder characterized by the loss of the ability to execute or carry out skilled movements. Yeah, so you can't move lah.
Skilled movements.
It's so okay. I think what he's talking about is where the person cannot form or cannot encourage their muscles to form the shape of the mouth and then to project a syllable or a word or a sound, right? Yeah. So that would be a neurological disorder, okay, that needs therapy with the speech therapy and a neurologist.
Okay.
Selective mutism.
Yeah. You've
Sorry?
mentioned speech therapist a few times.
Yeah.
Does it mean that if the person overcomes his difficulties when it comes to his speech, his confidence will come back and he'll start speaking a little bit more?
A little bit more, yes. So we've seen
Okay.
cases like that where they gain a bit more confidence. They're able to articulate a little bit better, a little bit smoother, that they feel more comfortable to communicate with another person.
Interesting, Jerry, because Muhammad Ghazali is asking the question also. And this is about how young can you diagnose selective mutism, because he says, how do we differentiate between developmental issues like speech impairment and selective mutism?
Okay.
So how young can we actually...
That's a tough one, man.
That's
That's a
a
tough question for
tough
Jerry.
question. It's a tough
Yeah,
question.
yeah. And I would, because usually they come in when they are from kindergarten onwards, so it's about 5-6 years old. But just let me double check. I don't think we would diagnose it any much younger.
I think it's quite hard to tell, no? Like,
Yeah,
some of us, for example, when I was growing up, I was a very quiet kid. I was.
I think quiet kids and kids who don't talk are different. You know what I'm trying to say? It's very different. My sister was a very quiet kid, right? But and we discovered that it was only because no one gave her anything stimulating enough for her to talk about.
Right.
So we had to learn to develop conversations around her, and then she suddenly exploded. You know, she was just one of those kids. She from a very young age, she didn't like
So she was
frivolous conversation.
okay. Was she introverted?
A bit, but she
Okay.
isn't now. She's come out of it, you know.
Yeah.
So it's quite interesting.
So you see, what happened to
Yeah.
the good old days of letting things develop naturally, rather than at some point just because someone is experiencing a little bit of an issue and all of a sudden it gets blown up.
Yeah.
It's
It's a
but-
different time. It's a different time we're living in, I guess.
But that is different, you see. I think now the parents are more informed and they are more well read. So these disorders come to mind, whether they can manage it earlier so that they can give a better start for their children.
So they want to nip
So
it in the
good.
bud, right?
Yep,
Before
yep,
it becomes
yep.
a major problem.
Yep.
Some
So
keep going.
typically even in the book, right? Typically, the diagnosis can be done at a younger age, but usually it's not picked up until after the age of 5 when they have gone to formal school. Yeah.
The question also being asked, and something I never occurred to me: can selective mutism, in the long run, hamper someone from being able to speak at all? Can you lose the ability to speak?
If there's a deterioration and the anxiety it increases, it's not dealt with, it is possible.
Oh.
Right? Yeah. So that's why we encourage, people to come forward, or the parents to bring the children forward if they suspect or if they're struggling. Because it would not just be that they cannot speak. There would be other behaviors that you would see. Poor social skills, quiet in different environments. It's not just
Wait,
in
we go back on
one
air first. Sorry.
environment.
Okay, going back on air. Stand by. Kylie Minogue! I should be so lucky right here on The Big Show, 1FM 91.3. We're so lucky to have Dr. Geraldine Tan from the therapy room with us every Tuesday morning. And today we're talking about selective mutation.
Mutism.
Mutism. Sorry. Yes,
You're horrible.
mutism.
Talking about
Selective
X-Men,
mutism.
And our Facebook page.
Selective mutism is the mutation is the different variants of COVID.
Oh, God.
Oh, right. Okay. Now we know. Yes, our Facebook page has just come alive with this. Jerry, what can parents do? Obviously there is sending the child to therapy, but when they're at home, what can parents do if they have a child with selective mutism?
So creating that very safe environment would be essential. So forcing your children to talk would not help, right? So if you know that your child has selective mutism, the first thing, especially in the school environment, is to let the school know so that the school teachers do not misunderstand the child and do not call on the child to read or answer questions in class if they are not able to. That only compounds the anxiety and compounds the problem, right? Work with the healthcare professional, the psychologist or the therapist, so that we can advise whether the child needs a separate room for like oral examination or to do presentations. What kind of social help yeah, that they need, or social skills that they need in school, things like that.
Jerry, should parents with kids who have selective autism, mutism, should they?
There, you see, I said selective mutation. He just said selective autism.
No,
FD.
selective mutism. Now, this is serious. Should they keep their eyes open to discover their child's passions and use those passions to create conversations so that the child becomes more comfortable conversing?
Yes, that's a brilliant thing that you mentioned. So for the teen, that was a success case also, because she successfully completed her O levels. She could do her oral. She brought in, and mom told me, so I was primed already, that she loves to draw. But it was so bad that she couldn't even draw for me in the beginning. So what I did was I had coloring pages, and I said, would you like to color instead? So she said, she nodded her head. We took the color pencils and she started coloring in. And that broke the ice for her. It helped her feel comfortable. It helped her feel safe. And that was something that she liked, drawings, colors. So yes, we use things that are comfortable for them. Very often, if they cannot speak with me, I don't force them to speak to me. I do have them draw for me, write for me, if they can. They would feel a little bit shy gesticulating, so they would not. Yeah.
Actually, I was thinking, this, you know how sometimes when you go for a foot massage, right?
Yeah.
When the person massages your feet, right? You go, ouch, right? So for someone who's like totally, silent for a long time, right? Just send them for one foot reflexology session. Maybe you'll hear some sounds coming out.
You see, Jerry?
What do you think?
What do I do with this man, Jerry?
I don't know.
I'm just trying to think of
don't know.
all.
I'm telling you,
all these
creative
methods.
ways.
One of our listeners
Creative.
has come up with the condition you suffer from.
Okay.
Selective naughtyism.
Naughtyism.
But it's true, right? I've never heard of, unless before you start your foot massage session, you tell the person, just a soft one. But if you ask them
can't
to
tell.
just do a regular foot massage session, I think 80% of the people will make some kind of sound. Either
Oh my God, this
Jerry, we'll put Glenn aside. Here's another one that's brought up. Do I have time to ask the
No,
question?
we will play a song first.
Okay, play a song and then I'll
you didn't
ask
see the
this
red
question.
card, FD.
No, I
Three
didn't.
times.
Did you show him the red card?
I did.
He did. I
Okay.
didn't see it.
All
Okay,
right.
thank you.
Here's
Sorry.
El King right now. X's and O's on the Big Show. 1FM 91.3.
I think we've got a person here who's a little anti-technology, but interesting question. With the amount of time kids spend on mobile phones, iPads, with e-nannies, things like this, can this cause an anxiety with people that then leads to selective mutism? I almost did it again.
Okay.
Can that happen?
Okay. So I love this question. With the phones and the devices, can they lose their ability to socialize face to face? I totally agree. So I'm very annoyed with the whole pandemic and all the social distancing. Will it cause selective mutism? No, they're still talking to people. It's not that they are not talking. They are just awkward talking to people. That's all.
Okay.
And I had to shift my lampshade because Nina wrote and PM'd me that my lampshade is crooked.
Yeah, I was just
Nina!
getting all the OCD people driving us crazy. Not us, I mean.
But I'm like that now. I'm looking at your photos, in the frames, right, on the wall. They're quite straight. If they are crooked, I will be pointing it out to you as well, because I can't see like crooked
Crooked stuff.
pictures on walls and all that. But I didn't see the lampshade.
I didn't see it.
Maybe because I'm being blocked.
Well, I'm also very focused on
Trying to get on my
Jerry.
tech side, by the way, the CEO of
I
our
don't know
Big Show
why
Tech,
she was
Xiaohui,
looking at it.
Okay,
to
Jerry.
put a screen up there somewhere, so I can see everything.
Yeah. Second question from Siu Cheng. When dealing with people with selective mutism, do puppets help?
Puppets.
Yes.
In
Yeah, hand puppets.
hand puppets, yeah. So you
Can you
Yes.
see I love you?
How-
Please don't
my
break
puppet.
my heart in two.
Oh, let me.
Wooden heart.
careful, I'll stick my hand up your shirt and then you'll be my puppet. I was very careful. I said your shirt. Oh my!
I found my. Oh,
Oh, so cute.
There, see?
It's an otter. Is it an otter? Raccoon.
hi everyone.
So
Can you see I love you? Please don't break my heart in two.
so you actually use these during therapies with people with selective mutism.
I found it. One little kid was trying to look for little Reki earlier. So
Jerry,
now I
admit
found
it. I
him.
mean, come on, confess to us. Sometimes when no one's around, do you like play with the puppet? You're just the both of you
Oh, yeah.
in the office, as in.
Glenn! Glenn!
It's like, hello, Rocket. How are you?
Jerry, I'm sorry.
You know, right? That's
Ayo.
Rocket.
That's Rocket, yeah, the raccoon.
Yeah. In Guardians of the Galaxy.
Oh yes. Looks like no, but it's not.
You know who's in?
Mine.
You know who's in that pocket, right? You know who's in that in that puppet? Bradley Cooper.
Oh dear you. Okay, I'm glad that it's making you so happy to see him. But yes, the question was, can hand puppets help? Yes, hand puppets do help. Sometimes talking to this is what we call a transitional object, where it is not another person. They don't have to stare at another person. It helps them to feel safer and more comfortable to express themselves.
So do ventriloquists have some mental disorder? Jerry.
I'm not gonna diagnose any professions now.
Okay.
Oh no, my lampshade is crooked. Nina, you make me look at my lampshade.
See, now I'm looking at the lampshade.
Where's this lampshade?
You cannot see.
Oh no, it's blocked by
by
the
so many
arm,
things.
the microphone arm.
No,
It's not just
How big
crooked;
is
it's
it?
damn crooked.
It's gonna fall off already.
Is that one of those clip-on lampshades, right, Jerry? It's a clip-on
Yes.
lampshade, right? Yeah, okay.
You just kind of like let it, and it's gonna fall again. So
Yeah. Or-
Everybody is coming through. Your lampshade's crooked. Your lampshade.
You know, I heard, I don't know how true this is, our marketing department, who's come up with the Big Show t-shirts and our station t-shirts and all that, I think they are coming up with a Big Show lampshade.
They're hard at work right now. I think some of them at Spotlight looking for materials already.
We're waiting for that.
Jerry,
We can wrap up soon.
Muhammad Ghazali, how do we parents reduce the anxiety with our kids? We've already said it's not talk. Are there exercises? Are there anything that these parents can do specifically?
So we've spoken about being very gentle with them, keeping the environment very safe with them. Typically, these children can speak with their parents. There's no issue speaking with their parents. So these parents can sit down and start introducing them to different environments that may be fearful to them. Script with them. So come up with short scripts, introduce them, expose them. So the parents can do a lot, and we work with the parents actually. Yeah.
You know, Jerry, I was watching a movie once, and someone actually lost her ability to speak after a traumatizing experience. I think the movie was Friday the 13th, I think. You know, how real is this, like, in real life, right? If someone gets a major shock and is unable to speak from then on. Have you
Yeah.
encountered any cases like that? Like a
So
major shock?
personally, no, but theoretically, in our studies, there have been cases brought up where someone can be so traumatized that they don't speak at all, but they don't speak at all. So it's not
At all,
selective
yeah.
mutism. It's not, different environments they can speak and another environment they can't. So this one is they're so traumatized that they cannot speak at all.
Yeah, and I see that as more a medical disorder than a mental disorder. So I'm trying to
Okay, that's interesting. Why?
right.
Why medical?
Yeah, why
because
medical?
because
I would've
it is
thought mental.
no because as you said, selective mutism is selective, right? Selective, right? Depends. The person doesn't.
Certain anxious situation.
Yeah, the person is not mute throughout, but a situation like this where a person is traumatized based on a major shocking event or something like that, this person has lost his ability 100% to speak.
I would think
So
it's medical if it was a fall or
Physical,
an
yeah.
accident and something
Something
physical
physical.
happens.
what
and you
about
can't talk.
amnesia, right? You're in a traumatic experience and you forget everything. That is not a mental
Interesting.
disorder. That is a medical disorder.
Amnesia,
Psychological?
medical or mental disorder?
Both medical and psychological. So there is a medical component because a part of the brain is affected, but it is also a psychological issue where it could be caused by trauma. So I think when you're talking about the previous case that you were saying where the person completely loses the speech, it is psychological. I would think it's more psychological because no part of the brain is actually affected, but it is the trauma. So it's a post-traumatic stress disorder, a symptom of post-traumatic stress disorder that might have caused the loss of speech.
Okay.
Wow. Jerry,
Yep.
Siu Cheng, very, very active today. Do people, just one last question, Shaun, I promise you. Do people with selective mutism sometimes latch on to the so-called security blanket?
Off?
It could be an item, it could be whatever. And when they have that with them, they are more relaxed
Safe.
and able to speak.
Like a puppet.
It could be, yeah.
Puppet
no,
could be a
this
security
is
thing.
this is literally something they carry around with them.
It can, if it helps to calm the anxiety, they can bring it around. They might not want anything. So we've tried it with some of the children with selective mutism, but they don't seem to take on to it very much, but it doesn't mean they cannot. So those with anxiety might need a safety blanket, like you say, right?
Right.
But not all of them. Yeah.
Okay.
So we
Not
can give them, but it doesn't mean that all of them would take to it.
Do these kids have imaginary friends? Maybe one of these Tuesdays we can talk about imaginary friends.
We did talk about it sometime, not as a
yeah?
topic by itself, but yeah, we did kind of talk about it. But yeah, we all have imaginary friends at some point or other.
No, I don't have. I never had an imaginary friend.
I did when I was young.
Yeah,
Really?
real
Yeah.
friends.
It's like you must call them out, is it? Because
No,
I
they just-
never had an imaginary friend, I have
They're
to
just,
say.
I
they're
got
just
no
there.
one.
You play with them. They're just there.
Yeah.
Oh,
Yeah.
that's a bit freaky.
Then we need a seance also.
That's why. It's like, wow. I mean, imaginary friends.
Yeah. I've had.
Is it a spirit?
No, it's just a.
No,
friend.
it's not
just
a spirit.
No, it's just a friend.
Just a friend.
Just a friend. They're all
Okay.
looking at me real weird now.
Yeah, I think on that note,
No,
we shall say goodbye.
we spoke about it, and it's very normal. It's developmentally normal to have an imaginary friend when you're young.
If I had a kid, I'd say no. No imaginary friends. Real friends.
Oh no!
Go outside and make a friend.
what is
Parents out there,
imaginary?
do not listen to Glenn. Oh dear.
Jerry, we have to bring today's discussion to a close.
Huh,
But
it's 9:00
Yeah.
already.
Yeah.
but
Yes, it is.
be-
Oh
before
dear,
we
so fast.
before we close, Vivian has asked a question. Could we talk about HSP, highly sensitive persons, next week versus sensory processing disorder?
Oh.
Okay, okay.
That's
La-
just
okay,
a suggestion.
Next week is the last Therapy Tuesday of the year. Do we want to
Yes.
end with something so
Oh, yeah.
heavy?
Exactly.
Okay, we'll do it in
Oh.
January.
Yeah, we'll leave it to you.
Up to you, yeah.
Yeah, we'll leave
what
it
do you
in
call Jerry?
January.
You know,
Yeah.
is Santa Claus real?
Yes, he is.
He's my imaginary friend.
He is.
Imaginary friend, right? Okay.
He's real.
Okay.
But noted. So, highly sensitive people as well as sensory processing disorder. Got it.
Yeah.
Any last words for
Actually,
everybody, Jerry?
I wanna mute some of these highly sensitive
people.
people. We all
We
know.
have to end.
Terrible. Any
Of
words?
some-
We have to
Any
end.
words for
Sorry.
everybody, Jerry?
Yes, yes. So I'm gonna take the silence of a different sort. I think the COVID has been such a terrible time, and Omicron came like Megatron. No, not Megatron, but Omicron. And I was given this book, Stories of a Pandemic. And I want to encourage everybody not to be selectively mute on mental health. So one of the pages of, I don't know which page is this. So there's a collection of all the different stories and the best stories. So one of the Straits Times, in fact, it was December last year that this article came out. Chua Moi Hong wrote an article on the DBS Piyush Gupta on his past mental health struggles.
Oh.
And so will COVID-19 be the catalyst that normalizes acceptance of mental health issues in the workplace, perhaps when more bosses admit their own struggles? So I want to encourage people not to be mute or selectively mute about mental health, but speak up about mental health.
Okay.
So a little
done.
appeal there.
All right.
Well done, Jerry.
Thank you so much, Jerry.
I'll see you all next week again.
Yes.
See you. Don't forget to put on your Santorina outfit next week. Huh?
Oh, yeah.
Our Christmas
Send me
special.
one and I will wear.
You be careful. You don't
Yeah.
know what he'll send you.
I got very small ones.
Can buy from Shopee. Very fast to send to you.
I regret asking already.
Okay.
Bye,
you take
Jerry.
care.
Bye bye.
Bye, Jerry.